So, hello everyone, and welcome to today's webinar. I'm the country manager for GBC Health, Corporate Alliance on Malaria in Africa, and I'll be your moderator today. I'm very excited to be hosting this session, and thank you all for joining us. Today's webinar, titled Sustaining Malaria Intervention Amid COVID-19, is organized by the Federal Ministry of Health's National Malaria Elimination Program, the Roll Back Malaria Partnership, and the Corporate Alliance on Malaria in Africa, CAMA, in commemoration of this year's World Malaria Day theme, Zero Malaria Starts With Me. The aim of the webinar is basically to discuss challenges and opportunities of bringing malaria interventions to scale and how to mitigate the impact of the COVID-19 pandemic. We will also deliberate on ways various sectors, including the government, private sector, and multilateral institutions can mobilize resources to sustain efforts to prevent, detect, and treat malaria. And then we'll also look at present guidance on how Nigeria as a country can maintain and continue malaria intervention in the face of COVID-19. And I'm sure that we have participants from other countries, and I'm hoping that you'll be able to learn from this as well. We have an amazing lineup of speakers to dissect this issue. But before I introduce our speakers, I have a few housekeeping items to cover about this presentation and the webinar platform. First, today's webinar will be available on demand after the live session. Today's deck and other related content, including the key takeaways, will be shared with all partners after the webinar. Next, we would love to hear from you during today's presentation. If you have a question for our speaker, please feel free to send it through the Q&A tab at the bottom of the Zoom platform. And also, we'll be answering questions at the end of the session. We will try to unmute participants and so they can actually speak and give their questions at a time. And finally, we would like to encourage you to share today's webinar with your social network using the hashtag Sustaining Malaria Intervention and Zero Malaria Starts With Me. And also feel free to follow the handle of the various organizations that are listed, the Federal Ministry of Health, the NMEP, the Aliko Dangote Foundation, CAMA, the Access Bank, WHO, World Back Malaria, and a host of other organizations with their handle. So without any further ado, I would like to kick off things off by welcoming Dr. Ahudu Bala Mohammed, who is the Director and National Coordinator of the National Malaria Elimination Program, for a brief remark. For those of you who do not know the NMEP, the NMEP is the body responsible for formulating and facilitating policy, guidelines, and coordinating the activities of partners and stakeholders on malaria elimination efforts across Nigeria. So at this point, I will hand over the platform to Dr. Audu. Please, Dr. Audu, take over.
Thank you, Ochuku. To my panelists, I'm really very glad that all of us are around to participate in this World Malaria Day activity for 2020. This is not the, we have so many robust way of commemorating the World Malaria Day, but because of the COVID pandemic, lack of traveling, and also lockdown in many parts of the country, this has given us an opportunity to reach out as many people as possible, share knowledge on malaria, and also to listen to people if they have some issues that they want clarification. So I'm really happy to have all the panelists and also our vast audience that were keen enough to join us in this meeting. And my prayer is that this meeting will be very, very successful and very enlightening. And once again, I want to thank the Global Health and also CAMA for organizing this webinar meeting. Thank you all.
Thank you, Dr. Audu, for that brief and succinct remark. In the same vein, I would like to welcome Ms. Nancy Watherfield, the President of GBC Health, for a welcome remark. Nancy? Nancy, please can you unmute yourself? Yeah, we can hear you.
Sorry.
Okay, thank you.
Thank you. Thank you for all joining us today, and I'm very pleased to join my colleagues here on this esteemed panel. I'd like to start by thanking the Federal Ministry of Health's National Malaria Elimination Program, the Roll Back Malaria Partnership, our Corporate Alliance on Malaria in Africa, and other partners who have been working so hard together to organize this webinar today. This is a pivotal moment in the history for global health. We are approaching an unprecedented World Malaria Day. Countries across the globe are in the throes of responding to the COVID-19 pandemic, which, as we know, is straining national health systems, challenging businesses, and devastating families. After years of steady declines, the numbers of malaria cases is on the rise, and the COVID-19 pandemic threatens to further derail some hard-won gains. We have all seen the myriad of ways in which the pandemic poses a threat to our fight against malaria, and that makes today's discussion all the more important. Like malaria, COVID reminds us of the importance of prioritizing health, working to achieve universal health coverage, and addressing the needs of the vulnerable populations. Robust systems and multilateral partnerships makes us more able to fight the diseases we are already tackling and make us more resilient to emerging challenges. Every dollar that we invest in the fight against malaria helps build stronger and more resilient health systems, as these are central to combating existing threats like malaria and emerging the new ones like COVID. More than ever, we must unite to protect our hard-won gains against malaria and effectively address the existing and emerging threats to global public health. While our ability to connect and convene has been hampered, the problems on the ground have intensified. So it's more important than ever that we connect as a community in all the ways that we can. We need to ensure that our malaria voice is heard and that we go the extra mile. We're going to have to be innovative, and we're not going to give up, because every life does count. Malaria remains a key focus for GBC Health, and we will continue to fight against the disease till we achieve zero malaria. We've mobilized the powerful collective voice of the private sector to drive programmatic impact locally and to help shape and influence policy globally and through dialogues, action, and investment. The private sector has and continues to be an indispensable advocate, partner, and stakeholder in addressing epidemics and many other health issues. Corporate programs can maximize their impact by aligning themselves with national strategies. Investments can be pooled from small, medium, and large companies, global and local, to grow the amount of capital that flows into these programs. Data can inspire political action and stimulate investment, and innovation brings new systems, interventions, treatments, and partnerships. So let's remember that zero malaria starts with all of us, from policymakers and business leaders to those in vulnerable communities. We're looking forward to continuing and expanding our efforts alongside all of you until zero malaria is reached. I greatly look forward to hearing from our speakers and continuing this vital dialogue. Thank you. And remember that zero malaria starts with me and with you. Thank you so much.
Thank you, Nancy. That was a very good remark. And also emotional in a way to get everybody to be on board in the fight against malaria. So moving on to the keynote presentation, I want to invite Professor Olubenga Ayodeji Mokolu. Professor Olubenga Ayodeji Mokolu is a renowned professor of pediatrics at the University of Ilorin Teaching Hospital in Nigeria. He's an international consultant providing technical support on capacity building, resource mobilization, and strategic planning to national malaria control programs across Africa. He was joint winner of the 2017 National LNG Prize for Science in Nigeria. He served on WHO Technical Expert Group on anti-malaria guidelines and many malaria advisory bodies. He founded the Center for Malaria and Other Tropical Disease Care and serves as the Malaria Technical Director to the National Malaria Elimination Program in Nigeria. Prof will be speaking on bringing malaria to zero a collective responsibility. Prof, over to you.
Yeah, thank you very much, Ojiko. And I want to welcome the various participants to this webinar. Mine will be to set the tone and to deal with some basics about malaria. Now, the first thing is to advocate that the Zero Malaria Starts With Me challenge. It's something that we should really make to go viral, such that everybody really becomes a participant. We need the hashtag to begin to read in millions across everywhere. Now, talking about the malaria situation, we have gained some mileage between 2000 and 2015, when the burden of malaria reduced by about 41% and the deaths from malaria by about 62%. But today, malaria is still very high. According to the World Malaria Report 2019, we had about 228 million cases of malaria in 2018. And with respect to death, we have about 405,000 deaths annually from malaria. The implication of this is having about 1,350 air accidents from a 300 capacity plane, which makes malaria an important and in fact #1 killer disease. And Nigeria in particular contributes about a quarter of these numbers and about 1/5 of the deaths that do occur. The question is, how do people get malaria? Largely, we know they have it from the bite of the female Anopheles mosquito, but they can also have it from accidental blood transfusion that is not screened and mother-to-child transmission. The fourth method is animal to man from macaque monkey. Now, we have some issues that we understand about malaria, that it is an interaction between the parasite, the environment, and the host, that is the human host, that bears the burden of malaria. And that begins to suggest to us the type of actions that we are supposed to take. So trying to reduce death from malaria and bringing malaria to zero comprise a number of integrated actions that include prevention of the disease, making a diagnosis of the disease, bringing about effective treatment of the disease, and providing supportive care for those who might have had a severe disease. And this is what is leading us to our conversation on the pathway to zero malaria. So when we say zero malaria, what does it entail? It's important to understand what this means at all levels. When we say zero malaria, we mean zero malaria transmission, that is from person to another person through the mosquito bite. Zero malaria infection, that means somebody suffering the disease at the moment, and zero malaria death. So these are the three components when we are saying zero malaria. Now, I will take on the zero malaria transmission. There are two critical components of zero malaria transmission. Number one is prevention, to reduce the vector, to reduce access of the mosquito to human beings. And this comprises of actions like appropriate environmental management, the use of insecticide, long-lasting insecticidal nets, in some places indoor residual spraying, and when people have a reason to be outside from their houses for a while, they use personal protection. These various actions focus on reducing the vector. The next action is to stop the parasite as a preventive strategy. And this includes efforts that are made to stop the parasite in pregnant women through intermittent preventive therapy, to stop the parasite in children, especially in areas that have the right climatic conditions, which we call seasonal malaria chemoprevention, to prevent the parasite establishing itself in non-immune persons coming to an area where malaria is common. That we call chemoprophylaxis. And we're also looking forward to adding the vaccine to join in this armor of the tools that we use to stop the parasite from getting itself established. So that looks at prevention, but I'll just highlight critically, especially at this time, the role of government and malaria as a multisectoral challenge. On your screen, you will be seeing 2 cities that are looked at via the Google map on one side and on the left side. The city on the left, you will see obviously it's disorganized. The one on the right is disorganized. Better organized. If you look at it, over a 3-year period of trying to collate cases of severe malaria, 97% of all our malaria cases came from the city on the left. And there was nearly no case from the other city. For us to have a more graphic understanding, the following slide shows how those cities really look like in reality. You can see this is an urban area, it's not a village, and yet you have this type of cities and all the debris that you can see, and there are drainages passing through where people live, and that is the place that accounted for the 97% of all the malaria that was seen over the period of observation. And none was from this city that is well laid out and having this type of arrangement. That's just to show us the critical importance that we also need to deal with our environment. The next thing is to look at the value of insecticide-treated nets. Long-lasting insecticide-treated nets. I've shown us here pictures of the use of long-lasting nets in different contexts, depending on the sleeping environment of the individual. And I know that sometimes it is said that we cannot use it because our environment is hot, but I need to say to participants here that really most of those things are a lot more fables. The insecticide nets are very useful, and once we have one, they are able to last for about 3 years in the very minimum, with very known ways of taking care of them. So this is very pivotal to prevention of malaria, and it's an individual responsibility to use your nets. Now, going on to zero infection, we have just 2 major actions. Testing to ensure that the diagnosis of malaria is made, and the recommendation is to test all suspected cases before initiating treatment. And then the use of appropriate treatment. And the recommended treatment for uncomplicated malaria is artemisinin-based combination therapies. I need to assure us that they remain very effective, as can be seen in this graph that is showing that over 80% of cases that were tested already showed clearance of the parasite within 2 days. By the 3rd day, most of the parasites have been cleared. I need to reassure us that the ACTs remain very effective to treating malaria. And then we talk about zero deaths, that is preventing mortality when people already have severe malaria. I'm happy to show you this next graph that shows that with appropriate intervention, when we introduce injection artesunate and proper supportive care, you can see that graph showing a rapid decline over some years, from malaria being responsible for about 36% of mortality to a situation where its contribution to mortality had come down to about 6%. And so the medications are effective when applied appropriately, which entails recognition, urgent referral, providing the specific anti-malaria that is needed. As a collective responsibility, I would like to divide this into 2 categories. For us as individuals, what are the actions that are needed from individuals to ensure that we contribute to bringing malaria to zero? We have the action of maintaining our environment to be clean. clearing drainages, clearing bushes, clearing all of these actions. We have that duty. Then we have the duty of the use of preventive measures, particularly the use of long-lasting insecticidal nets. We want to encourage that we should sleep under this net. By now, we expect a household to have a minimum of 2 nets. And particularly pregnant women and children under 5 should be prioritized for use of these nets if they are not sufficient for everybody in the household. Other preventive actions that may be recommended should be applied, like for the pregnant women who are supposed to have 2 doses of intermittent preventive treatment in pregnancy. And in some cases, we use seasonal malaria chemo prevention. It's an individual responsibility to use that. Then we have the responsibility for correct diagnosis of fever. We need to submit ourselves for testing. The advantage of that is we will know whether that fever is malaria. And if it is not malaria, it helps us to concentrate on what it could be without losing time. Especially now in the context of COVID, it is more important that we get tested so that we can know what is responsible for our fever. The use of ACT for treatment, we all should use, when it is confirmed, ACT is the treatment of choice. And we should spread the message to encourage other people to do the same things in terms of prevention and in terms of diagnosis and testing. At the level of government, what is needed critically is a demonstrable political will through budgetary commitments at all levels. About 500 million is needed, $4 million is needed annually, for instance, in Nigeria to fight malaria effectively. It doesn't mean that government has to pay out this money directly, but we can explore public-private partnership. We can explore concepts like backward integration and find a means of ensuring that there is demonstrable commitment to malaria and that the commodity needs are met. We need conducive environmental activities in terms of road, housing, drainages, clean environment. This should be part of our national multi-sectoral response. Then we need, as government and partners, to facilitate access to preventive measures, making sure that people have access to long-lasting insecticide nets, where it is proven that IRS will be the intervention that is appropriate to have access to such intervention and to all other preventive interventions that have been identified. And we also need to provide access to diagnosis. RDTs at the lowest levels, microscopy at higher levels, but even for the purposes of rapidity, to ensure that there is RDT that people can easily access so that diagnosis is made very easy. We also need to provide access to facilitate treatment in terms of quality ACT that is affordable. There is need for government to provide an environment for research, for new tools and better understanding into diagnosis, treatment, and prevention of malaria. We also, at these levels, partners and government need to maintain a very robust data repository to track and develop evidence-based policies on malaria. So basically, what we've just tried to acquaint us with is to show to us that everybody is a stakeholder in terms of prevention of malaria. As individuals, you have an obligation to keep your blood system free of the parasite so that even if there is any bite, the likelihood of transmitting to another person will be near zero. We have the responsibility of keeping ourselves healthy and keeping our environment and using preventive measures. As government, we have a responsibility of providing the enabling environment, creating the atmosphere that will facilitate access to preventive and treatment commodities that is needed to sustain malaria, and to gather information systematically in order to better tailor our actions as we move forward. Together, we can bring down malaria to zero. Thank you very much.
Thank you so much, Prof, for that beautiful presentation. So in a nutshell, I would say you're trying to say we need a multifaceted approach and partnership to be able to bring us to end. And we all have a role to play in this fight. Um, so I will move on to our next speaker. With the current public health challenge facing the world right now, people are asking questions like, how do malaria programs continue in the face of COVID-19? What do we do? How do we ensure that lives are not affected? We do not have more challenges while trying to actually manage malaria. Our next speaker, Dr. Linda Ozo, will address this topic. Dr. Linda is working as the Malaria Program Manager at the World Health Organization, Nigeria Country Office. She has supported efforts of the National Malaria Program since 2010 and has played several roles both locally and internationally to support the global malaria elimination efforts. Dr. Linda, please, you have the floor to have your presentation. Hello, Dr. Linda, can you hear me? Please, your line is not muted. It's not unmute your line, please.
It's unmuted. Can you hear me now?
Yes, we can hear you now. Thank you.
Okay, thank you very much, Achuko, and thanks to the National Malaria Program for convening this webinar. I think this is quite timely and important as we battle through the COVID-19 pandemic. And I want to thank Prof for a very detailed presentation. That makes my work a lot easier. And so talking about how National Malaria Program and partners can maintain and continue the malaria intervention in the face of COVID, it's something that we need to think through and everybody needs to be acquainted with. As we know, the COVID-19 pandemic is testing the resilience of health systems, more so in areas where the health systems were not functioning optimally. And so it means that ensuring access to core interventions is key and remains a very critical strategy for reducing the strain on the health systems. And these interventions including, so how do I move the slides? Sorry, I'm not very IT savvy. All right, so the outline of my presentation will be on the background and a very brief technical component, some of the concerns, and then I'll delve into what WHO's advice on the COVID is. Without wasting time, I'd like to get us in tune with where we are in the national malaria response. This has been mentioned previously by the national coordinator and professor, but just to reiterate that currently the National Malaria Program in Nigeria is implementing a 7-year strategic plan with the central goal of achieving prevalence of less than 5% by 2020. We're in 2020 and now we're faced with this COVID pandemic that seems to be an additional layer of challenge to achieving the aims of the national program. The attainment of this goal is enshrined within 7 key strategic components or strategies, which stems from case management, vector control, procurement and supply management systems, BCC, strengthened surveillance systems. And so where are we in the attainment of these goals? When we look at the malaria burden in Nigeria, next slide, please. The malaria burden in Nigeria, currently we know that the entire population of Nigeria is at risk of malaria. And annually for 2018, we recorded about 57.2 million cases, and Nigeria continues to occupy the most unenviable position within the global malaria space. accounting for 25% of the global burden of disease, as well as 53% in the West African region. The national malaria prevalence, the prevalence of malaria in Nigeria stands at 23%. And this is a very, it has been a reduction from what we saw in 2010 when it was 42%. So we've noticed about 15% reduction in prevalence. The annual deaths as of 2018, we recorded about 95,000 deaths as in Nigeria, which accounts for about 23% of the global deaths in malaria. So in order to refocus and appraise, we had to appraise and refocus the National Malaria Program through aligning what we call the high burden to high impact approach. It's a multi-country WHO-led approach aimed at helping countries to get back on track towards the response on malaria. And so this will align with 4 key pillars of ensuring that political will is optimized to reduce malaria deaths, that we roll out very key strategic information to drive impact, we provide better guidance and strategies, as well as a coordinated and national response. And so to reduce the prevalence to less than 5 and deaths to near 0, the National Malaria Program has rolled out key interventions in alignment with the National Strategic Plan, which also clearly aligns with the Global Technical Strategy. And so these interventions, as Prof mentioned earlier, stems from prevention, use of long-lasting insecticidal nets or IRS, also the intermittent preventive treatment in pregnant women, as well as some chemopreventive approaches in children under 5, in seasonal, living in seasonal, in areas where there's seasonal transmission, like in the Sahel belt. Also, scaling up diagnosis and treatment, ensuring that every case of suspected case is tested and every tested positive case is treated. And also ensuring that we track and treat and we record every single case of malaria. And of course, this cannot be achieved without a strengthened health system. Now, drilling down to COVID and malaria, we know that COVID is a pandemic, which is really affecting the world, and it's spreading very rapidly. And so WHO has made efforts to send very clear messages to countries on what needs to be done. If I am to quote from the director of the Global Malaria Program, it says that this is not the time to scale back your planned malaria prevention, diagnostic, and treatment activities. If anyone living in a place where malaria develops a fever, he or she should seek diagnosis and care as soon as possible. And so when we look at COVID and malaria, there aren't much similarities except for the symptoms, which makes all the difference. We know that COVID is caused by a virus, while malaria is a parasitic infection. And the symptoms, of course, we know COVID mostly will present with fever, headache, cough, sore throat, weakness, and joint pains. And some of these symptoms are similar to what we have in malaria. And so that complicates, or rather raises some concerns for the malaria program. In terms of diagnosis, currently in Nigeria, what we use for the COVID diagnosis is through PCR, polymerase chain reaction, but malaria, we have a rapid test for malaria, which takes maximally 20 minutes and you have your results. And while COVID is a pandemic, surveillance in Nigeria is still very active, while malaria, because it's endemic, we've had malaria over the years and our prevalence is still about 23%, most malaria surveillance is passive. So why is COVID outbreak a concern for malaria program? We know that as at today, Nigeria has, what we have on the slide, that was as at the time I made the slide, Nigeria has recorded about 873 cases of COVID in about 22 states. And this is spreading very rapidly. And focus has shifted drastically and wholly towards control and elimination of COVID-19 outbreak, rightfully so. And health workers and other frontline workers have been affected severely by the COVID-19, and this has affected response to other diseases. Should this be so, one would expect that while this response is ongoing, other diseases will be getting adequate attention, but because this is a new virus globally, not much a lot is still being studied around the virus. So all attention had to be focused on COVID, and the mechanism of spread makes it quite unique. And so every effort has been on COVID. Now, I won't say totally relegating, but it would seem like other diseases are not getting as much attention as they would deserve in the face of COVID-19 outbreak. Health systems are further weakened, and this is compounded by the outbreak. And this is even worse for areas where we know that there were already very bad or areas grappling with very severe issues, like in the Northeast, where there has been insurgencies, people living in the IDPs that do not have maximum access to healthcare services. Health-seeking behavior also has been suboptimal even before the COVID time, and this may have taken a negative turn since the outbreak, so that remains a concern. And we also know that COVID and malaria share symptoms, as I had mentioned earlier. And many countries have adopted different strategies. In Nigeria currently, there are restrictions of movement, and there are total lockdowns, especially in big cities, and this may also impede on access to care. So why is malaria, what do we do in the context of the COVID outbreak? We know that COVID-19 is testing the resilience of the health systems I've mentioned before, and we're recognizing the heavy toll that malaria exerts on the vulnerable populations in Nigeria, as well as the fragile health infrastructure. And therefore, WHO underlines the critical importance of sustaining efforts to prevent, detect, and treat malaria. And all these are in the effort to save lives. This underscores the critical importance to mitigate sickness and death from malaria. This is very, very key. As we work towards a control or elimination of the COVID outbreak, we must ensure that services aimed at sustaining responses as sustaining essential services like malaria to prevent deaths and save lives should be optimized and sustained. And so WHO urges countries not to scale back on planned prevention and case management interventions. We should ensure that services to essential services to deployment of essential services will further reduce strain on health systems. So what should governments and organizations do in the face of this pandemic? WHO has developed an operational manual. Next slide, please. WHO developed an operational manual to guide countries towards maintaining essential services in the face of COVID-19 outbreak. I've placed the link on the slide, and so CAMA, GBCH can share the link for everyone. And also, the key thing is that we should maintain malaria preventive and case management services, mainly the LLINs. In the case of Nigeria, the long-lasting insecticidal nets, make sure that all population have access and sleep inside nets. And this is more so as we move into the period of high transmission. This is April, the mosquitoes are beginning to reawaken. By May, it will get worse, and we really need to make sure that we scale up and maintain scale and scope of these interventions. The intermittent preventive treatment in pregnancy should be prioritized. SMC in eligible areas in the Sahel belt and those areas eligible for SMC should continue. For case management, we should make sure, I know that there is fear around fevers. People who have fevers may want to seek care or start treating presumptively. But the guidance is that we should, as much as possible, aim to maintain testing before treatment using RDTs and ACTs for treatment. And also, we have to ensure that we sustain and intensify the surveillance, else we may not know the magnitude and the extent of what we will be facing. And so surveillance remains key in the face of COVID-19. We have to make sure that every fever case is tested, every tested case that becomes positive is treated, and every treated case is reported and recorded. It's key, even in the face of COVID-19. We need to deploy measures that protect health workers and communities. How do we do this? We know that most malaria services are provided through health facilities. And so it may be necessary for government and partners, as we deploy anti-malaria interventions, we think through approaches and methods of deploying other PPEs alongside, and also providing training and support for other infection prevention and control strategies within health facilities and within the communities. We need to support facilities and communities, by the way, to maintain hand hygiene and other respiratory etiquettes, as well as maintain supply of anti-malaria commodities. Supply of anti-malaria commodities is an area that I think it needs to be given adequate attention, because while there is a global restriction on movement in different countries, we know that most anti-malaria commodities have to go through the air or the ship to get into the countries. So I would expect that in countries where, especially in Nigeria, we may have adequate stock as of now, but we do not know how long the COVID outbreak is going to last. So it's important that we ensure that the supply system is fluid, that we maintain stock at all times and we avoid stockouts, because as we get into the malaria season, we're going to be seeing more and more fever cases. And so we need to make sure that every one of those fever cases is tested. And we have to make sure that everyone in the community is protected through vector control measures. And we need to intensify and maintain risk communication as well as behavioral change. So in summary, I would just like to say that to sustain effective malaria control, we have a comprehensive package we should be maintained. And this package stems from malaria prevention, case management, surveillance, behavioral change, procurement and supply. So all the spectrum of activities that need to be sustained, that need to sustain malaria program we should make efforts as a national program and partnership to ensure that these services are not interrupted. So in conclusion, I'd like to say that Nigeria has made progress in malaria situation, though prevalence the prevalence has dropped from 42% in 2010 to 23% in 2018. Malaria is endemic in Nigeria and everyone is at risk, but continues to take a toll on the poor, especially children and pregnant women, and accounts for a quarter of the global burden of disease. Interventions must consider the importance of both lowering the malaria-related mortality and ensuring the safety of communities and health workers. And again, this is not the time to modify existing interventions. Government should not scale down on interventions. We should aim to sustain and improve on what is already being done. Just to reiterate that presumptive treatment should be strongly discouraged. I know there has been questions around when we get into widespread community transmission, what do we do? Again, when we get into such scenarios, we may have to consider very specific interventions like presumptive treatment or mass drug administration, but that has to be for specific populations within a given time. And so joining my voice to the Professor Mokolu's, I'd like to reemphasize on the theme for this year's World Malaria Day, which is Zero Malaria Starts With Me. But if we must achieve that, how do we do that? We have conditions. We must sustain and maintain universal coverage of interventions. We must optimize health-seeking behavior. We have to sustain services amidst the COVID outbreak. We have to have a committed partnership and governance. And we have to optimize tracking of malaria, as well as address most of the socioeconomic and environmental factors. Are there challenges? Yes, but these are surmountable challenges. And so, I would like to say, your fever could be malaria. That's the slogan we have chosen. Get tested. Zero malaria starts with me. Thank you.
Thank you, Dr. Linda, for that beautiful presentation. I would like to encourage all speakers, the ones that will be coming after, to please keep to time so we can ensure that we engage the participants as agreed at the end of, before the presentation and the webinar ends. And then also I'm seeing a lot of participants are putting questions on the chat platform. Please, if you have questions, do that on the Q&A session. There's a platform there you can Q&A. For proper coordination, we'll advise that you put your questions there and you can put other comments on the chat platform. Thank you so much. So moving on to the next, Nigeria as a country contributes greatly to the global malaria burden, and it's very important that a country malaria intervention is sustained and scaled up to achieve zero malaria. Let's welcome Dr. Audu again, the Director, National Coordinator, National Malaria Elimination Program, to speak about Nigeria's Malaria Programme Continuity Plan in the face of COVID-19. Dr. Audu, please take over.
Oh, thank you, Ochuko. I'm pleased to be back again and to also share my recommendation to the two previous speakers. They have really digested a lot of the malaria situation in the country and the whole world. So as Ochuko has said, I'm the National Coordinator of the National Malaria Elimination Program. The National Elimination Program is in the Department of, it's a division in the Department of Public Health of the Federal Ministry of Health, with the responsibility of coordination and oversight of malaria control and elimination activities in the country. The national program is being guided by the National Strategic Plan. At the moment, we are almost to the end of the strategic plan 2014 to 2020, and we have done malaria program review, and we have identified many of the key challenges affecting malaria intervention in the country. But of recent, the COVID pandemic has come as a surprise to everybody. But despite that, now that we are approaching the rainy season, and we know that Nigeria is endemic and contributing substantially to the world's population, we have to keep on doing our activities so that we can continue reducing the morbidity and mortality. And so we have a very robust national malaria strategic plan. Most of the intervention has been mentioned by my key previous speakers, and this intervention have been very useful and very impactful. And as was mentioned again by the two previous speakers, when we have a lot of investment and sustained intervention, we're able to reduce malaria burden from 42% in 2010 to 23% in 2018. So in a situation whereby we found ourselves at this pandemic period, it will have a lot of setbacks on how we go about ourselves. All of us know the challenges of no movement because of the lockdown, the challenges of bringing all commodities or moving commodities both outside and within the country. And we also have challenges of our patients because of the security control, the availability to go to the health facilities. You know, and we also have challenges with our health workers. Many of them have been diverted to run the pandemic control and prevention. So we are under very tight resource constraint. And also with the issue of the pandemic, it means a lot of interventions that we usually do, we have to modify how we do it in such a way that it will help us continue our interventions without interruptions. As you quite know, the pandemic period has really made people to pay more attention to the coronavirus. Meanwhile, malaria is also very devastating. So in the national program, we have some specific tasks to do. Our tasks, as I mentioned, consists of coordination and oversight. We develop policies and guidelines. We develop operational plans. We develop frameworks, training manuals, job aids, etc. And we also partake in building the capacity at the subnational level. And the similar thing is also being done by our state program managers and their teams, because the implementation of malaria is mainly at the subnational level, and kudos to that. Now we also, among ourselves, we also set up targets and indicators and monitor the progress we are making. We carry We get data on surveillance, we get data from the health facilities. We also carry out surveys. We also do some therapeutic efficacy studies, insecticide resistant monitoring, so as to be sure that the tools that we are using are very, very effective. And these tools are really very effective. And it has led some many countries to go to pre-elimination. And from also the reduction of burden that we have seen in the country, it means this to take us to the promised land. And another key role that we also play is that we do resource mobilization within and outside the country. In particular, we are putting a lot of energy to improve domestic resources. So both from government and our private sector partners. We have also been getting support from our major donors through the Global Fund, the Presidential Malaria Initiative, the DFID. We have also been getting a lot of support from our Roll Back Malaria Partnership in Geneva, WHO Global Malaria Program in Geneva, and WHO country office. We have also gotten a lot of support from the Alliance for Malaria Prevention. This is an organization that the African Leaders Malaria Alliance, so many other organizations have really been supporting us to carry out this task. And this task also involves how can we overcome the issue of this pandemic so that we have a smooth implementation, with the hope that by May, June, the endemic, the malaria coronavirus pandemic would have plateaued or even maybe go to zero. So we are doing everything possible to make sure that services are not restrained. And in the program also, we do a lot of capacity building. We also identify and promote research activities that we use it to change our policies, change our strategies, guidelines, and also programming. We also do community mobilization, and also we also carry out a lot of communication, especially with the advent of the social media, etc. We are using all these available resources and tools to make sure that we are able to address malaria situation in the country. So, but at the moment, due to the lockdown and restricting interstate movement, etc., we have no option then also to use the electronic platform to reach out to all our stakeholders. So in the National Malaria Program, we have a robust coordination framework. And this coordination framework, we have internal coordination that is within the program. We have various branches, we have various subcommittees that we do engage using the available media that we have. We have the Zoom platform, and all these branches, they have been doing their daily meeting like from home, but almost like in the office. And this has gone a long way for us to continue what we are doing. Some of us, once in a while, will also come to the office to carry out some tasks. Then we also have some external coordination. We have meetings with our partners, both within and outside the country, to address some key malaria issues, to bring everybody on board, and also to even help us write some requests for proposals, say like for the Global Fund, or also the issue of Presidential Malaria Initiative, etc. So, as I also mentioned, we have a Skype platform for our small meetings. We have the Zoom for larger meetings, and we also use our NMEP website for toolkit repository, and also webinar, and also social engagement and sharing information. So with all this is, I'll say that our hope is that despite the pandemic, we'll try as much as possible to make sure that our services are not disrupted. If we foresee any troubleshooting, etc., we do everything to address it. Thank God also we have empowered state program managers with their team, so they are able to carry a lot of tasks even in our absence in the states, and we hope this thing will continue. We'll also keep on using the social media to reach out to the community. So one of our other major challenge also is that currently we have only a single license for Zoom, and in a day we do so many meetings. Sometimes some meetings that you think it will take 30 minutes, it will end 3 hours because so many issues has to be trashed. So these are some of the few challenges that we're having. So at the moment, the national program is looking towards a very robust malaria intervention all over the country. Initially, we have some constraint in the last 3 to 4 years. We have about 13 states that don't have funding, but we are now able to get approval from the boards of both the Islamic Development Bank and the World Bank. We have submitted successfully a global fund proposal for funding to 13 states, and then the Presidential Malaria Initiative supporting 11 states. And all these sorts of funding, they have also earmarked, they are going to earmark some funds to help us overcome some of the challenges of the the COVID-19 pandemic challenges that it has posed to Nigeria and Nigeria and beyond, the world at large. So we'll continue doing our best. We reach out to all our partners that have been very, very helpful to us to make sure that we don't have disruption. Thank God many of our community activity will come over around July. So we hope that the country will have overcome the challenges of the COVID-19 so that we don't have any issue. But despite that, if situation doesn't warrant, we'll take all the necessary measures. We are trying to get as much as possible testing material, personal protective equipment. We are synthesizing our health workers and the community to enable us carry out many of our tasks that we intend to do this year. So this, let me be so brief. I want to stop here. Chico, over to you.
Thank you, Dr. Audu, for that. And so moving on, our next speaker is Dr. Melanie Renshaw. She is the Chief Technical Advisor for the African Leaders Malaria Alliance and the co-chair of the Roll Back Malaria Partnership to End Malaria, Country Regional Support Partners Committee. Melanie will speak on sustaining RBM's partnership support for continuation of malaria services in Nigeria to mitigate the impacts of the COVID pandemic. Thank you, Melanie. Over to you.
Thank you, and thank you, everybody. I don't have a PowerPoint presentation. I'm just going to give a few highlights of the type of support we are working to provide to countries during the COVID pandemic to ensure that malaria services are sustained. Just an hour or so ago, WHO released the results of some modelling that shows that if we are able to distribute the mosquito nets that are planned for 2020, and if we see a reduction in malaria case management to about 25% of the normal level, we would almost guarantee that we would get a doubling in the number of malaria cases in 2020 compared to 2018, and that there is a significant risk of a rebound back to where we were 20 years ago. So it is absolutely imperative that we avoid this at all costs. The type of support that we're providing to RBM, the RBM Partnership to End Malaria, includes technical assistance to countries. Given the nature of the pandemic, it means a lot of that support is remote. So through remote consultants assigned to support the country, and as Dr. Audu said, for example, in planning of LLA campaigns, a number of countries have already this week continuing with their LLA campaigns despite the pandemic of COVID. And so Berlin, for example, has support to redesign their campaign so that it is door-to-door. Leaders now planning something at the end of this month, and it's basically about changing the way you do your campaign so that there is still social and reduces significantly any risk.
Hello, Melanie. Hi, can you see me? I'm putting the mic properly. We can barely hear you. Maybe you can.
Video off and see if does that help at all.
Okay, so we're having. Can you maybe you should move closer to your mic? That could help.
Can you hear me now? I'm to be sitting on my mic.
No, we can. We're still having the same issue. Are you? Hello?
Hello?
No, it's still not better. You're sounding very far away. Hello? Hello? Hello?
Hello?
Okay, so it's still like we can't hear you clearly. I think it could be the microphone. The audio, your audio is not clear. I don't know. I think it's the microphone. Maybe you want to try. Hello? Hello?
I don't know why it's not working.
Okay. Hello? Just go ahead and speak. Let's see if we can hear you clearly now. Just go ahead and speak.
Okay. So basically, sorry everybody, we're working to provide remote technical support to countries. For example, in LLIN campaigns, that's for Benin, Guinea-Bissau, they're already rolling out their campaigns in the face of COVID. We're also providing support for resource mobilization, reprogramming of existing resources, looking for additional resources. For example, the Global Fund announced that there is $500 million available for Global Fund portfolio optimization for the 3 diseases and to help sustain health systems during the pandemic. And we're helping countries to access those resources as and when required. We're doing commodity tracking across the continents to see who has stock out, and when and where there is a stock out, working to see what we can do to fast track commodities to countries. We're also looking at very high level advocacy to maintain malaria high on the political agenda. So, for example, the chair of CAMA, the African Leaders Malaria Alliance, is contacting the other heads of state and government of Africa, encouraging them to sustain malaria services during the pandemic. And at the same time, the RBM Partnership to End Malaria, WHO, ALMA and the Global Fund are writing today to all of the Ministers of Health of Africa, encouraging that malaria and essential health services are sustained. As and when a country needs a political discussion or a technical discussion with senior professionals in the Global Fund, in WHO, in RBM, we're able to organise those discussions with ministers, and also we're documenting best practices so that we can share those best practices with countries. So, for example, with Benin's LLIN campaign continuing now, we can share how they did that during the pandemic so that other countries can learn from their experiences. And when they reach a state where there are not enough resources to in the Global Fund with the traditional donors, we're also going to work to see if we can fill additional gaps in malaria programming. Which hopefully there won't be, but you never know. At the same time, supporting countries in their Global Fund applications. It's great news that Nigeria got their application in, but if any requirements to support grant making so that monies are immediately available in 2021, we're on standby to provide that support. Apologies, my line wasn't good. Over.
Okay, thank you, Melanie. The line was all over. Key talking points from your presentation, and that we could also include in the takeaways to participants. I think that will be very helpful. Is that fine, Melanie?
I didn't hear you.
Oh, really? Okay, all right. I'm going to send you an email afterwards.
Okay.
Thank
Yeah.
you. Thank you very much. All right, so moving on, the private sector plays a very vital role in mobilizing domestic resources, capabilities, and innovative ideas towards eliminating malaria in Africa. Our last two speakers will bring in the private sector perspective into this conversation. I want to welcome Ms. Omobolanle Victor Lania to speak on investing in health, including malaria and COVID-19 control. Omobolanle Victor Lania is the unit head, Sustainability Corporate Communications Access Bank. She's also the co-chair of the Corporate Alliance on Malaria in Africa. Omobolanle is a sustainability professional with about 20 years experience in the field of sustainability and communications, spanning various industries, including manufacturing, media, and the financial sector. She was the only West African on a global team that recently developed the global principles for responsible banking. She was awarded the prestigious CEO Employee of the Year 2018 award at Access Bank. She's also a two-time recipient of the highly coveted Most Astounding Sustainability Practitioner in Africa. That's the Sarah's Award. She was further honored, especially by Sarah, for the efforts at championing sustainability in the Nigerian financial sector. Omobolanle, please, you have the floor.
Thank you, Ochiko. Good afternoon, everyone, and I'm pleased to be here co-hosting with Ochiko the webinar and with our other partners. Basically, I'll just be speaking to the private sector and investment in health, and I will be focusing just on malaria, of course, as we commemorate the World Malaria Day, and also talk a bit about COVID-19. Thank you. Next slide, please. I work with Access Bank, and our vision is to be the world's most respected African bank. We have operations across the world, and I think this is quite important, especially as we have participants on this webinar from all over Africa. And I also think that it's important to note that our mission is setting standards for sustainable business practices that unleash the talents of our employees, deliver superior value to our customers, and provide innovative solutions for the markets and the communities we serve. So our employees and our customers are people, and these people are the ones that we're speaking about today, a wide range of stakeholders that are being impacted or affected by malaria or COVID-19. So again, is how do we as an organization in line with our mission work together with other stakeholders to provide innovative solutions to address these challenges. You can take me to the next slide, please. It's an Indian economist that said that economic growth without investment in human development is unsustainable and unethical. And I find this quite interesting and exciting because I'm a proponent of the fact that we need to invest in people. People are our greatest assets. And as we invest in our people, then we tend to seek to invest in the health of the people. Next slide. Next slide, please. So there is, previous slide, please. Previous slide, please. Thank you. So there is a correlation between health and business. We all know that the private sector especially plays the role of being a driving force of the economy. I always say the banks play the role of oiling the wheels of commerce. And human resources is also the driving force of the private sector. Okay, so again, we can therefore understand the fact that our people and human beings generally are the sources of success, competitiveness, and added value of businesses. So we can see that there is, a link, and that link for me is undeniable, between health, human resources, and the global economy. So investment in health becomes a priority and a necessary step. I'd mentioned earlier, and as you've seen from the mission statement of Access Bank, that we place people at the core of our business. Our people and our stakeholders are a part of our corporate philosophy and our sustainability ethos. We believe that the success of our business is linked with the well-being of our community. And I've mentioned earlier on that we play or we operate in various communities or various locations across Africa and on the global community level. So again, we have our people all over, our customers all over, our various stakeholders all over the global community. Therefore, we see it as important for us to ensure that people live healthy lives wherever they may be located. Next slide. So over the years, basically, Access Bank has taken various steps to ensure that we contribute to the development of health systems, especially in Africa. And why Africa? For many of the diseases, Nigeria and other African countries bear a high burden of many of the diseases. I mean, we're commemorating World Malaria Day, and we've seen the data earlier on, so I'm not going to go into all those statistics. We bear a very high burden in Nigeria, and we cannot afford to ignore this. Also, Access Bank is an indigenous African institution, which is why our vision is to be the world's most respected African bank. And therefore, we know that good can come out of Africa, but we know that we as Nigerians and we as Africans, we are responsible to solve the challenges that we face in Nigeria and in Africa. And over the years, we've realized that investing in health is not something that you do alone. The success of health investment is in partnerships, is in collaboration. And that aligns very clearly with SDG 17, which speaks to partnerships. So it's the reason why, for instance, Access Bank is on the board of the Private Sector Health Alliance of Nigeria. I serve as the co-chair of Corporate Alliance of Malaria in Africa. We are on the board of the Nigerian Business Coalition Against AIDS. And of course, very recently, my CEO, in partnership with Alhaji Aliko Dangote, constituted the Private Sector Coalition Against COVID-19. And today we have over 70 other organizations that have joined us to be members of CACOVID. What this points out is that investment in health for private sector is not something that we can do alone. It's something that we need to do in partnership with one another so that we can increase the level of impact that we all have. Another key aspect is innovation. And of course, I'd mentioned this earlier on as I was speaking to what our mission statement is. Innovation is key in addressing challenges that we're faced with, be it social, environmental, economic, whatever challenge. And of course, that also applies in the health space. So for us, we've been applying innovative approaches in partnership with the various organizations and the stakeholders that we work with. Is the reason, for instance, why we initiated what we call the Better Mama, Better Pikin initiative. So we know that maternal and child mortality is very high and is also high, for instance, in northern Nigeria. So what we did was to come out with a service such that we encourage mothers to save, and as they save, we support them, we give them a good rate of interest on their savings, and then we take a portion from this interest and invest in partnership with health management organizations. We invest that money in HMOs for them so that once there's any sign of illness or once they don't feel well, they can go to the hospitals that are on the scheme, either themselves or their children, and get treatment. So they don't have to think about the out-of-pocket cost of getting medical care. And of course, with respect to malaria, it's the Malaria to Zero initiative that we did in partnership with the Private Sector Health Alliance of Nigeria, CAMA, and GBC Health and other private sector organizations. With another approach is our advocacy approach. As we've seen, there's been a lot of advocacy, for instance, around COVID-19. And I think that advocacy is a key component when you speak to investment in health, because you could invest in getting the health systems right, getting the medical facilities. You could invest in getting the drugs. But if you do not invest properly in communication and advocacy, you're not going to get the people to go to the hospitals to get treatment or to get tested or to even understand what their statuses are. Okay, so advocacy is very key for us, and we do that on a wide range of health situations, including malaria, of course, HIV, maternal health, and others. And the final aspect is investment in itself, which in this case refers to either investment of our financial resources in partnership with partners and stakeholders, or even investment of technical skills, in-kind support, you know, as a way of investing to support what the private sector is doing to intervene in the health system. Next slide. Okay, so, and I think this is about my last slide. So I'll speak to the current COVID-19 pandemic and malaria. We all are very aware, and the speakers that spoken before me had mentioned about COVID-19. I think the Dr. Linda from WHO had also tried to do some comparative analysis between COVID-19 and malaria. And basically, there is quite limited information, in my opinion, on the direct link between malaria and COVID-19. But we have quite a number of similarities. Apart from the similarities in terms of the symptoms, okay, and as they overlap, apart from a few of the symptoms, as we've seen earlier on, for me, they're both killer diseases. They both affect vulnerable populations. And we see that there's been a surge of interest as well in certain drugs for COVID-19, including chloroquine, which for many of us, we've been very familiar with chloroquine, using this medication when we were much younger to treat malaria. So the fight against malaria is one of the biggest public health successes of the 21st century. And we've seen a situation where there's been a drop in global malaria deaths by about 60% since the year 2000. But yet we still have now number of malaria cases being on the rise, and this COVID-19 pandemic really threatens to further derail all of our hard-won gains. And also, I mean, it's important that as we think about continuing to invest in health as private sector organizations, especially for private sector organizations on the call, we look to do this in a way that is very impactful, that has high impact, and which is, you know, working with the public sector, working with the relevant government agencies and other private sector organizations to effectively address existing and emerging threats to global health. Next slide. Next slide, please. Okay, so finally, the call to action slide. Thank you. So there is a call to action for all of us as we think of investing in health and continuing our investments in health, because we need a multi-sectoral approach to health investments. I think that's a crucial way forward. Investments in health systems is no longer a joke. Many people are jittery right now, also because of the situation of the health systems in Nigeria. Again, you see the private sector organizations come up either as COVID or the efforts being made by the indigenous oil companies or the multinational oil companies working with NNPC, to support all of the government efforts. One thing that this tells us is the need for all of us to work together. I don't think I can overstate the essence of partnerships, of public-private partnerships. So really, to get Nigeria to zero malaria, we need a more robust strategic plan that will be implemented. We need the private sector involvement in a more strategic manner with respect to addressing malaria in Nigeria, and of course with respect to addressing other health situations in Nigeria. Also, the question of the future really belongs to those organizations that pay most attention to key non-financial metrics, such as community and health investments, because we then save people, we save lives, and as we save lives, we have those people that are able to then contribute to the continuous success of our organizations. So just to say finally that the Corporate Alliance on Malaria in Africa will continue to advance progress made against malaria. We call on governments, on partners to uphold the progress and commitments made in the global fight to end malaria. Thank you very much.
Thank you, Ms. Omobanale, for that inspirational presentation. So finally, into our next speaker. A little twist to this presentation is going to talk about sustainable approaches to malaria from a private sector perspective. Let's welcome Dr. Francis Aminu. He is the Director of Health and Nutrition, the Aliko Dangote Foundation, and responsible for managing about a 100 million program tagged Aliko Dangote Integrated Nutrition, that's the ADFIN program. He's a development nutrition specialist with more than 20 years of professional and cognate experience in program management and organizational development in food, markets, and health system. Dr. Francis, over to you.
Oh, that's up.
Hello, Dr. Francis, can you hear me? Hello? Hello, Dr. Francis? Can you hear me?
Yes, can you hear me?
Yes, we can hear you now.
Oh, okay. Yeah, that's why I was just trying to apologize that I won't put on my video because of the nature of my internet here.
It's fine, it's okay.
However, yeah, let me just go straight to the point. But before I make my presentation, let me just introduce the foundation to those of us who are meeting Aliko Dangote Foundation for the first time. Just briefly, our vision is to is an African whose people are healthier, they are better educated and empowered, which is the core of our human capital development as an organization. We are making a shift towards Africans helping other Africans, and sometimes Africa helping the whole world, because that's the way we're looking at it. We believe Africans have to be in charge. We believe in making an Africa an open space to the world. And then through our ability to scale up proven solutions and influence people to adopt smart, relevant interventions. And then finally, we are setting up Africans up for successes through healthcare, through education and empowerment initiatives, and all those humanitarian relief services we carry out. Can you take me to the next slide? The previous speakers have mentioned the situation, the progress we have made, and I wouldn't want to belabor you with that, but rather, can you go to the next slide, please? Then the next one. The next one is just to really emphasize, again, if you look at where we are with the progress we have made and what we still need to do on a sustainable basis, funding is very, very critical for sustaining all our efforts. And as a result of that, I just decided to point out this. If you look at that chart, you realize that in other countries that have made progress, tremendous progress, there is a kind of local and domestic funding actually being injected into malaria control programs. And if you look at Nigeria, I don't know whether the author is the author of the report, WHO, that made the mistake, or it's just that that's the reality, that there is an inadequate domestic financing in Nigeria's case. The next slide too, I just want to flag that up for us to know what we need to do next. Then we have mentioned, we've listened to the speakers. They've mentioned those core package of recommended interventions ranging from diagnosis and treatment to the use of vector control, using long-lasting insecticidal nets, issue of indoor spraying, residual spraying, chemoprevention, even for high groups like the infant children in those areas of seasonal transmission and pregnant women. We've listened to all those things. But like I said earlier on, there is still a very kind of funding gap. It's very huge. And we need to really consider that in our kind of quest for sustainable approaches. The next slide, please. Yes, we've listened to my colleagues from Access Bank. This is very, from the WHO, the issue of how do we control malaria in the context of COVID-19. Just to add that, yes, it's true. If we don't do anything, then there will be a rebound. And that rebound can make all the situation even worse. In fact, we can't tell the way things are now. After COVID-19 pandemic, we're really not going to be, we are not going to remain the same again. In terms of, do we still maintain those gains? I'm not really quite sure. So we need to brace up ourselves towards doing that. The next slide, please. But there is a good news, which my colleagues from Access Bank has just raised. And that good news is that the COVID-19 pandemic has actually brought a kind of a power and promise in collective philanthropic actions of our business sectors. The private sector have actually come up with an alliance, a kind of a coalition to support the Nigerian government's humanitarian response, as she earlier mentioned. But I just want to still sound a kind of add to what she has said, that a responsible business action is a marathon. It's not just a sprint. It's not that we run the 100 meters and then we stop. So it is important that the response of businesses at this moment is not a solitary act of charity, but a long-term commitment to strengthen the social fabric. Remember that, yes, some people are still poor. The consequences of COVID-19, even on others that may not be infected, is still very huge. All this needs to be taken into consideration with our investment. So our investment will not just be address and contain COVID-19, but at the same time, whatever happens beyond. So the relief funds that are set to ameliorate the present suffering should be a true test for corporate citizenship that lies ahead of us. And that's the way the foundation is looking at it. And that's what is actually prompting our chair, Aliko Dangote himself, to really stay behind this and push it. But it's not just pushing it alone for this, it's pushing it forward. And then something that will form a basis for our own sustainable development, whereby the businesses will be contributing. The next slide, Steve. The next slide. In the next slide, I just try to demonstrate to us what those strengths that we have as private sector is. They will have different capabilities than the public sector. It's just left for us to magnify this and see where we can key in. And based on the keynote address speaker on the multi-sectoral nature of the whole issue, it means all businesses, not excluding any, should be brought on board and be part of it in terms of how they source their materials, in terms of their product or program or service development, in how they produce these products, and how they package, distribution, advertising, and the retailing. All these are very, very important. Next slide, please, for the kind of skills and capabilities that we have. Then again, I just picked this chart from the Zero Malaria Starts With Me toolkit that WHO developed for private sector and for all sectors. But this is just to summarize what specific actions, although some of us are doing that already, but we need to continue with this, even at this time. The funding we are having to operationalize the National Malaria Elimination Program and other community programs that we are having for residual spray, ILN, and all the rest. So we need to continue with all this. And even the issue of social marketing and behavior change. I've seen a lot of social marketing for the COVID-19. It's very, very important. But can we still find a way of actually making input on malaria messages in those programs? It's very, very key for us. Like I said earlier on, these are programs that are very, very important, but they need to latch on. We don't need to wait after the COVID-19 to begin to do that. The next slide, please. And on the next slide, yes, the beyond COVID-19, what should we be doing? It means we need an adaptive policy approach to strengthen all systems. It's not just health systems alone, but all systems, preparedness and response in Nigeria. We need to do that. And I will give you just a few examples to end my presentation. And that one is that of the Foundation's Malaria Control Program, which has to do with malaria control in workplace, where we have an effective workplace program that adopts the ABCDs of prevention, chemotherapy, bite control, chemotherapy, diagnosis, and treatment, and applicable use of technology, media, and all the rest for all our staff to make sure that they are safe, and then the workplace is better for them and make them more productive and healthier. Then the second one is our support to the National Malaria Elimination Program. We need to implement the strategy of engaging the private health sector, to eliminate malaria in Nigeria. That we have strongly determined to pick that up and continue with that. And finally, it's a program that we have that Ochuko mentioned earlier, on Aliko Dangote Foundation Integrated Nutrition Program. The ADFIN is something we're investing in new generational tools and building sustainable healthcare systems. If we don't revitalize our PHC, for us to be able to integrate management of not just acute malnutrition, but case management of integrated community case management of childhood illnesses, they need to come together because the resources are dwindling, but we need to bring together all our resources. And that is why I would like to call on all companies that are on this webinar and then others in such a way that we need to adopt the best practice, like my colleague from Access Bank mentioned in their interventions, and try a combination of use of either long-lasting insecticide-treated nets and outdoor spraying combined. I know it's expensive, but if we're able to combine this, it makes the whole thing more effective. And finally, we need to continue in the light of the lessons that we have already learned during this, that we are going to learn, because we are still in the COVID-19 pandemic situation. But however, the crisis has taught us that it is possible to forge new corporate alliances and that is inclusive, and then to activate all multi-sectoral networks for positive social change. Then we need to disrupt and transform failing systems. We all know, we don't need to complain again, that our systems all over, both market, both food, both health, for those public service provision, they are more or less failing. But again, the private sectors needs to come aboard with their skills and capability to help others. So I want to say finally that Zero Malaria starts with our respective companies, it starts with our employees, it starts with our communities, and with our country, Nigeria. Thank you so much.
Thank you, Dr. Francis. We've had great presentations so far, but I want to crave your indulgence to just give us a few minutes to take a few questions and answers before we wrap up. So we already have a couple of questions already on the platform. There are tons of questions. So I will start with collating by bringing out questions for the NMEP. So Dr. Audu, I hope you can hear me. I will take it one at a time. I'm going to just read out questions for the NMEP and then you respond, and then we'll move into another speaker, WHO. We have a couple of questions for WHO as well. We have a couple of questions for Access Bank, the Aliko Dangote Foundation, and everyone, all the speakers literally. So we will start with the NMEP. Dr. Audu, so there's a question around a platform for reporting data. They're asking, is there a platform for reporting data on malaria morbidity and mortality in Nigeria? Do we have a platform for that where people can just go to and see data on malaria morbidity and mortality? That's question one. Second, there's a question around, we've been talking about multi-sectoral plan of action on malaria. What has the role of the Ministry of Environment been? As the NMEP engaged with the Ministry of Environment in whatsoever in the fight against malaria? If yes, please, we would like to know. That is question two. And then we have a question on service delivery. Now we are talking about the need for testing. We know that we have challenges with testing at the primary health care facilities. Now, there's a question around what we think are the main challenges at that level. Why do we still have those challenges at that level? And what is the NMEP going to do differently moving forward to ensure that those issues are not faced with anymore? Yeah, so I think we can do that because we have tons of questions. Let's just, Dr. Audu, please, can you respond to this?
Okay,
if there's time, we'll come back to you. All right.
Okay, thank you, Ochuku. Okay, I've noted the questions. One of them is asking about platform for data. As everybody knows that there is a national health management information system, and it's web-based. It's called District Health Then the next one is the multisectoral sector, talking about the Ministry of Environment. The Ministry of Environment is also one of the line ministries in malaria coordinations. So we have been having regular meetings with them, and we know that they also have some very key role to do, especially issue of prevention. So we have been working together with them on so many issues, but I think we need to do more also. Then under the service delivery point, our challenges with the testing is that we have issues with health workers. When they do testing, the test shows negative, they will still go ahead and presumptively treat the patient, showing that they have been treating malaria for decades, and how can this test show negative? And then we also have problem of some RDTs are PEC, so they are not doing the best. But when we deploy under the program, quality assured WHO pre-qualified RDTs. So there is need for health workers to go for those type of RDT, which we have substantial list of them. Then there is also need, because of attrition at the subnational level, there are a lot of people that we train, but at the end of the day, they move to some other activities. Or we train the chief, the head of the health facility, but some of them don't cascade it back to. But in some of our mentoring mechanism, we have been also following up to see that the health workers learn and sustain use of the RBT. Thank you.
Thank you, Dr. Audu, for that. So I'll move on to questions for WHO. I'll just take three questions for WHO. Now, there's a question around how do we get political commitment, more political commitment and approval for continued implementation of malaria program? So we've been talking about political commitments and more investment from the government. How is the WHO and other partners, well, this is referred to WHO, how are you ensuring that we have high political commitments in malaria intervention? And then on to the next question. We have a question around testing as well, and health workers in health facilities. I think the NMEP coordinator has basically addressed some of this, but does WHO have any plan to actually ensure that health workers are protected in this time of COVID pandemic? And yes, to ensure that the work continues and health workers are protected in this time. And then we have another question on fumigation and use of IRS. Now we know Nigeria is heavily, malaria control is heavily tilting to the use of bed nets. They are asking question around, do we think fumigation and the use of IRS in communities should be considered as a part of preventive measures in Nigeria? That's for WHO. And then finally for WHO, we have a question around distribution of bed nets. Now that we know that we have this pandemic at hand, how do we intend to carry out distribution of bed nets while observing social distancing? So go ahead, Dr. Linda.
All right, thank you very much, Achiko. You may want to repeat the second question because my line was breaking up at the time you read out the second question. But I heard the first, which is how we support the political commitment to ensure that malaria gets adequate political attention. I would just like to say that WHO supports the country's agenda. And like I mentioned during my presentation, that through the HBHI, the high burden to high impact, we are supporting the country through the three levels of the organization to identify, package, and define areas of interest and support in organizing and convening all necessary support for malaria in the country. However, in terms of political commitment, I think directly with the government, the national program leads advocacy to the highest level of government, which WHO supports. And then the other I heard was about fumigation, what we are doing in terms of fumigation. I may need clarity on the question. Like I said, my internet was breaking a bit when you asked the second and last questions, but I heard fumigation. So I wasn't clear if the question was, are we supporting fumigation, or what is our, please, can you repeat the question?
Okay, yeah, no problem. So the question is around usage of fumigation and IRS. Now, we know that the countries, our intervention is more tilted towards usage of bed nets. So they're asking, will it be recommended to use IRS and fumigation as a preventive measures of control in Nigeria? That is the question.
Okay, so the first point to mention here is that fumigation is not a malaria control strategy. What we use in malaria is indoor residual spraying, which requires that through deployment of certain skills, you spray the inner linings of the house of individuals' sleeping areas to prevent, to kill the mosquitoes from within the houses and prevent them from attacking the individuals over a period of time. So fumigation, most times when they fumigate outside and maybe for rodents and others, but fumigation does not specifically target malaria. In terms of IRS, the national program as of today is using LLIN as the main thrust for vector control. And one would also expect that in the face of the pandemic, where we have to avoid or deploy social distancing and avoid as much contact as much as we can, then for Nigeria, where we have been deploying LLINs, we may want to improve and ensure that every household has an LLIN and everybody is encouraged to sleep inside a net.
All right, thank you for that responses, Dr. Linda. Now over to Access Bank. We have 3 questions for you as well. First one is, what is Access Bank doing in advocacy and communication towards reducing the burden of malaria in Nigeria? Secondly, there's a question around banks, the banking sector. I think that's more on the private sector, focusing on supporting Lagos State and Abuja, while other states that are highly burdened are actually getting limited support. Why is that, and what can we do? What can the bank do to ensure that this is changed, to ensure that we have maximum impact? And finally, okay, I'm trying to get this. I'd love to know what Access Bank is doing to innovatively support malaria program implementation as part of a CSR. So there's question around advocacy, then innovation, and then finally, location-wise, why more funding for Lagos State and Abuja opposed to other areas that are more highly burdened in terms of malaria? Mobolanle, please take over. I hope you're still there.
Yes, I'm here, Ochiko. Sorry, I was speaking and I forgot I was on mute. Okay.
Oh, okay.
Okay, thank you. So 3 questions I think. One is on what are we doing on advocacy. Another is speaking to private sector supporting Abuja and Lagos, right?
Yes.
And then the other speaks to what are we doing to innovatively address malaria. Okay.
Yes.
Okay, so thank you. So first of all, with respect to advocacy, our approach has always been, like I said, like I was trying to say earlier on, collaboration. So aside from using our own media assets, right, to communicate or for advocacy purposes. We work with a wide range of non-governmental organizations, right, with respect to advocacy. And these organizations, this is what they do on a day-to-day basis. This is all they know how to do, and they do well. So we use their platforms, you know, to get into rural communities, suburban areas, you know, to take the messaging to them. And also, I mentioned earlier about using of our own media assets. So be it whether our social media pages, and you can check that out, or even on initiatives that we work on with other partners. So Malaria to Zero, for instance, which is an initiative we came up with respect to bringing malaria to zero. That was even before this year that the theme is, you know, malaria to zero. I mean, we'd always felt the need for us to bring malaria to zero. And that on its own has its own website, has its own implementing partners, has its own team of people that work, you know, on a daily basis to ensure that we take messaging to people. We do the right advocacy using the languages of the local communities that they understand, right, with respect to getting the relevant information across to them. The second question that speaks to why do many private sector organizations work in Lagos and Abuja? I don't work in the other private sector organizations, so I may not be able to speak for them. Whilst this is not the case with Access Bank, I'll just use my knowledge of the environment to speak to this question. I think that the issue really is that the private sector seeks for credible partners. And many times when you seek for credible implementing partners to work with, you find out that they are concentrated in certain areas, okay? So especially in Lagos and in Abuja, you have a bit in Port Harcourt. We have some in the East as well, like in Enugu, but really, private sector is about accountability, is about transparency, and is about impact. And when you want to get that done appropriately, you need to work with the right partners. Working with the wrong partners may end up affecting negatively the overall objective of your project. So I can't hold forth for other organizations. And again, like I said, this is not also the case for Access Bank, because what we've also done further is to partner with ACT Foundation, such that we give funds to ACT Foundation, and then they give out those funds as sub-grants to NGOs from across Nigeria. So there's an open call, right, for organizations, for NGOs or CSOs to apply for various projects. And health is one of the platforms, right, that we support. Now, what you find and what we found in the call that we did for last year for 2020 projects is that there are some states that you don't even have any representation from those states, right? NGOs, either NGOs or CSOs that work in those states that are applying for grants or for them to intervene in projects in those communities. And which is why I will speak back to the essence of partnerships. Is essential that we partner, right, with organizations. So I may be seeking a credible partner for logistics to get medication into rural communities. Whilst I may not have an NGO in a certain state that works there, there's a way Coca-Cola gets its products, for instance, into every rural community. So I can then decide to work with Coca-Cola and use its logistics or its supply chain network to get those medications into those communities. So again, that is about innovation, and that takes me to the last question. So how do you innovate? Innovation around the challenges that you're faced with as you try to address the critical health situation or health challenges. One way is also by, partnering, okay? So I gave the example of, for instance, if you decide to use the logistics network of another private sector organization for your impact, okay? Another thing that we do really also is some of the organizations that we partner with, we use their platform for innovative challenges, okay? So for instance, we worked with the Private Sector Health Alliance on the Nigerian Health Innovative Marketplace. And one of the key outcomes from that is the self-urine testing kit, that won that challenge. We do that on the platforms of organizations we partner with, okay? And I think that initiative won a total of about $100,000, okay, for their project. And again, we have the work we do through our African FinTech Foundry, where again, there's call, to organizations or individuals that have ideas on how to address critical health challenges. One is ongoing. There's been a call for individuals and organizations with respect to addressing COVID-19. So it goes through, again, that process. You have winners that emerge, they're connected, with the right funding to expand their ideas and to ensure that at the end of the day, the society is better for it. Thank you.
Oh, thank you. I wish we had more time to actually go through all the questions. We have about 60-something questions here, and I'm just trying to collate, but we don't have so much time right now. We will ensure that we will collate the questions and get responses from the speakers and send it back to all participants via post the webinar. Thank you for participating in today's webinar. Special thanks to all our speakers. Thank you for everyone dialing in from different countries and regions around the world. We hope to continue the conversation. The fight against malaria is not just for a day, it's not just from World Malaria Day, because for half of the world, especially those in sub-Saharan Africa, every day is a malaria day. The fight continues, so we need to keep up the fight. More than ever, we must unite to protect our hard-won gains against malaria and effectively address existing and emerging threats to global health, to public global health. The decisions we make today will determine whether we will eliminate malaria or see a resurgence of this deadly disease. Everyone has a role to play. Zero Malaria starts with me, and it also starts with you. There are a lot of things that have been said today on what we can do moving forward as a country. Local domestic funding, we can't emphasize enough, is very important. And we need a multifaceted and a multi-sectoral approach to fight the disease and get to zero malaria. So thank you all finally. Once again, we will send you takeaways and the slides and everything, content for this webinar. We'll look forward to more engagement post the webinar. Have a lovely day and enjoy the rest of your day. Thank you.